So we are going to talk about why do people get heart attacks during exercise, why it is increasing these days, and what all can we do to prevent such episodes, and what are the risk factors? How do we basically look at the situation? Okay. In order to understand this, first of all, the important aspect here is not to uh, demonize exercise, because exercise is actually beneficial. Practically, exercise would prevent heart attack. It would lead to cardiovascular improvements, right? It would definitely help you in various aspects, like you can see in the picture given. It overall, over time, if you regularly exercise, there are vasodilations and angiogenesis which takes place throughout the body. New blood vessels are formed, mitochondrial biogenesis happen, new nuclei are formed, and your capacity to actually tackle with health problems, they increase. Even your capacity to tackle inflammatory processes going on inside your body increase. So exercise is actually an anti-inflammatory. It has an anti-inflammatory effect, right? So why would such a good thing lead to heart attack or precipitate heart attack? And there are reasons. In order to understand that, we need to still go into the depths of exercise. What exercise does to the body, and we will look at the effect of exercise and on each and every organ, as well as the physiology of heart. Okay, if you if you look at the organs, if you do targeted exercise, over time you would see skeletal muscle hypertrophy, or there can be hyperplasia. Fiber type switching can happen depending upon whether you are doing a cardiovascular exercise or strength training, right? And irrespective of that, blood flow will increase to whatever muscle you are exercising, and that muscle will have more blood vessel. There will be vasoreactivity, increasing the capacity, the compliance of the blood vessel to dilate and increase the muscle, blood supply. There will be increased metabolism throughout the body. So exercise is good for your insulin sensitivity, for diabetes. It is good for various biochemical processes, including mitochondrial biogenesis, lipolysis, and phosphorylation of free radicals, etc. Many things. If you look at the heart, over time, exercise can lead to cardiac remodeling. It can lead to hypertrophy of the heart, which can be good and bad in various aspects. And it can be cardioprotective. It can lead to angiogenesis there, meaning more new blood vessels can form there, and therefore the risk of heart attack would reduce. Then, how people get heart attack while exercising, right? See, while exercise, you basically increase the demand, and therefore your stroke volume, your cardiac output increases, your the capacity to handle more blood pressure increases there, metabolism, cardiac metabolism increases, blood flow increases. So overall, if you see, there is good, and there are very very good aspects of exercise, which is why exercise is recommended to everybody, no matter what your age is, no matter what your conditions are. Exercise are important. So what happens to your body during exercise, especially your cardiovascular response? We have to understand the cardiovascular response in detail to understand what would trigger an heart attack. Okay, so let's understand first that in cardiovascular response, there are various aspects to be looked at. First is your heart is a pump, so it has to pump blood, and cardiac output is the stroke volume into your heart rate. So whatever blood volume heart beats in one beat is the stroke volume, and that would depend upon various things, right? And heart rate again will depend upon various things, your nerves and hormones. Blood volume will depend upon various things, your hydration level, etc., etc., your kidney functions, your vascular resistance will depend upon various things. So everybody cannot have, you know, comparison cannot happen. Everybody will not have the equal tendency, equal response of increase in cardiac output, increase in stroke volume to exercise. Okay, and let's look at some factors how this happens, especially blood pressure. Blood pressure is a key factor here, because blood pressure is basically cardiac output and to peripheral resistance, which is the diameter of the arteries. Okay, this is what actually controls everything. Heart attack is one of the problem which happens when your diameter reduces because of plaques, or the capacity of vasodilation reduces because of hardening over time, plaque generation, that kind of an issue. So cardiac output is stroke volume into heart rate, and this depends upon your peripheral resistance, the capacity of your blood vessels to contract and relax, which increases over time while exercising, and the blood volume. Okay, so let's understand this aspect in detail. First, let's understand blood pressure. With each contraction, your body, your left ventricle, it pushes out blood, creating a pressure, which basically stretches the aorta, aortic wall, propagates through a wave through the entire arterial system, and this wave appears like a pulse on your various, on your radial arteries, your thumbs, your temporal arteries, sometimes, which you can feel that. At rest, the blood pressure which is generated with this stroke, with the systole of your heart, is around 120 mm of Hg, and you all know about this, but let's make a baseline, create a baseline here, and then the heart relaxes, which is the diastolic blood pressure. Diastolic blood pressure, when the aortic valves close and there is a natural elastic recoil of aorta, still it does not collapse. There is still positive pressure inside the arteries, which is around 70 to 80 mm of Hg. Okay, so diastolic blood pressure is also positive. And what happens with your blood vessels because of hardening, because of fat deposition, because of calcium deposition, because of atherosclerosis, over time throughout your body, your blood vessels can become hard, and this basically will increase peripheral resistance. This can also happen because of kidney malfunction, because body is not able to put out water as salt and water, so the blood volume increases, so the capacity of blood vessels to dilate has already been over. That also will increase your blood pressure. Peripheral resistance because of hardening, atherosclerosis, or kidney malfunction will increase your blood pressure. And if you really check the blood pressure in those arterioles, small arterioles, it can go as high, systolic blood pressure can go as high up to 300 mm of Hg. Yes, 300 mm of Hg pressure can go high, and this is at rest. Diastolic blood pressure can go high as much as 120 mm of Hg in areas where atherosclerosis is very high, in fat deposits, and the hardening of the arteries are high. The capacity of vasodilation is gone. So blood pressure can go high so much. So think about what will happen with this person if he is exercising, right? So this is the basic thing which you need to understand, that high blood pressure imposes a strain on normal cardiovascular function, on normal blood vessels, and severe hypertension can lead to various complications. It can lead to the degeneration, and brittle cracks can happen, brittle blood vessels can actually break and it can burst. You can have, if the bigger vessels are there, it can actually put pressure back on the heart, increasing the blood pressure, and the workload on the heart increases. Slowly, heart can go into heart failure. There will be cardiac remodeling, and that's why kidney patients develop dilation of the ventricles, dilation of the heart, right? So this is the key role player here, is the blood pressure. Okay, and blood volume, peripheral resistance is important, and this same thing applies to your brain. And people who have such a high blood pressure, they also have high risk of stroke, and that risk will also increase during exercise. Now, this is all during rest. Now, during exercise, what happens? Let's understand. This is a picture here of your blood pressure right? During exercise, if you do walking, hiking, jogging, swimming, cycling, there will be dilation of the active muscles, blood vessels. That means the vascular resistance will increase in that area of exercise, and blood will get redirected to the area, to the muscles who are exercising. So the active dilation actually leads to the increase in blood flow, and because there is a rhythmic contraction and relaxation of the skeletal muscle who is exercising, okay, there is a because you are active, you are exercising during exercise, that also puts pressure on the blood vessel, on the heart. This will again increase your blood pressure. This will increase blood pressure, only systolic blood pressure increases in this. That can go up to 140 to 160. Okay, 140 to 160, like you can see the red mark is going up to 140, 160, and then there is a plateau here, because then the increase reduces. Okay, general pattern, this is the general pattern in which systolic and diastolic blood pressure increase during continuous treadmill exercise. Okay, your systolic blood pressure rises, but diastolic does not rise. Diastolic pressure remains stable, or it basically reduces slightly during a treadmill or cardiovascular exercise. But when we talk about resistance exercise, it's a different picture. We will talk about this also, that also. So, in people who are, healthy or sedentary, or maybe even in people who are advanced athletes, the same thing happens. Diastolic blood pressure does not increase so much in cardiovascular exercise, but during maximum exercise by whatever people there, that this blood pressure, systolic blood pressure, can go up to 200, right? And the level of arterial blood pressure, most likely this reflects that the heart will have the largest cardiac output during that maximum exercise. So during that time your heart is pumping very hard. Okay, so you cannot sustain that for a very long time, because that time your heart and your body's aerobic demand will be very high. Okay, so what about, this is what happens during a cardiovascular exercise. What about this is the rhythmic exercise. Okay, what about resistance exercise? During resistance exercise, picture is different. During resistance exercise, the blood pressure response will be a little different. There the diastolic blood pressure will also increase along with systolic blood pressure, because in this case, large amount of, because strenuous type of exercise, heavy resistance exercise, this increases the blood pressure drastically, because there is a sudden muscular force compression, and suddenly the peripheral arterioles will compress, increasing resistance to blood flow. Okay, this is the difference between high with rhythmic exercise, something like a cardio cycling, which you can do for 30 minutes, and something where you are doing reps, 10 reps, 20 reps, and then you are like, okay, done. This kind of exercise, where there is, in cases of rhythmic form of moderate physical activity, there is a less risk of heart attack, and there are greater benefits over time. But in this kind of exercise, where you do very resistance training, and it shows very dramatic blood flow increase, and in case people who are untrained and who go on and lift very high weights, or go on and run very fast without doing any kind of regular activity, this can lead to a very sudden increase in blood pressure up to 250 also. 250 mm of Hg blood pressure, diastolic blood pressure could go up to 160. So this can be very disastrous. This can lead to stroke. This can lead to heart attacks. That's why exercise has a U-shaped relationship with your heart attack. Okay, those who don't exercise have a very high risk of heart attack, and when you start exercising, your heart attack risk reduces after a certain level. If you exercise way too fast, way too much, your heart attack risk again increases. So this is important to understand. Now let's understand, this is just about blood pressure. This is just one aspect. We haven't talked about other things. Okay, now let's talk about cardiac output. Cardiac output means the amount of blood which is pumped out, right, into 1 minute. which is the stroke volume into heart rate. And this is actually one of the most important indicator of your functional capacity. Meaning, if you're exercising to a very high amount, will your heart be able to withstand? Will able to withstand depends upon this. Okay, depends upon this. Depends upon your cardiac output. And in a resting state, if you are untrained, you're not training very regularly, then your left ventricle ejects around 5 liters of blood volume. Okay, 5 liters of blood every minute, 5 liters each minute. And uh, stroke volume and heart rate would vary depending upon your cardiovascular fitness status. People who have lower heart rate will have higher stroke volume. People, because their peripheral resistance they will be low. People who have higher stroke low stroke volume will have higher heart rate. Okay, so if your heart rate is around 70, yeah, and your beats per minute, the average adults will have that kind of heart 5 liters of resting cardiac output. Okay, so in this case your stroke volume will be around 71 ml per beat, 71 ml per beat, 70 beats per minute, cardiac output 5 liters. Okay, and in this, if you are an athlete, let's see this here, it is. Okay, stroke volume around 75, non-athlete heart rate 70. And if you are an athlete, the picture changes. Your heart rate, resting heart rate is lower, around 50, and in that case athletes also have an average same amount of cardiac output, 5 liters of blood, but in their case stroke volume increases around 100. Okay, so athletes have higher stroke volume, lower heart rate, but the cardiac output is same, resting cardiac output. Okay, so stroke volume is higher. Now in females also stroke volumes will be lower, 25% lower than men. This is what general gender differences are there. Now this is what we just saw. Okay, 500 m 5 liters per minute cardiac output, heart rate, and this is the basic thing. What happens during exercise? During exercise, if you are untrained, then your cardiac output increases rapidly from rest to steady state exercise rapidly, and then gradually it increases until a plateau will be there. Okay, and if you would see slowly, the plateau will be around 2200 ml per minute. 2200 ml per minute will be the plateau, meaning the stroke volume, the cardiac output will be this much, and stroke volume for this kind of a case will be around 113 ml, and heart rate, maximum heart rate which you can go up to is around 190, 195 if you are exercising very very fast. And if you are a world class athlete, right, if you are athletic very very high, then your heart rate will go high same way, and your volume will be higher. Your stroke volume will be 179 and your cardiac output will be 35,000. In this case, you can see there is a big difference between the cardiac output of a sedentary person and an athlete. It is almost double, almost not 1.7, 0.5. So this person, that's why athletes are much faster, they can do much harder work, they can do much more endurance training as compared to a non-exercise person. And if you are regularly exercising, slowly, your peak cardiac output will slowly increase. Okay, and this is the same thing which can be applied to stroke volume. Stroke volume is the amount of blood which goes out of your heart in 1 minute, and during exercise your stroke volume increases. Okay, and after a certain level your stroke volume will get plateaued. There will be a limit, after that you cannot. Okay, and this stroke volume will also determine how much exercise can you do, because if you see the difference between an athlete and a normal untrained person, here what changed the cardiac output was not the highest heart rate, was the stroke volume. The stroke volume was the difference, that people who are regularly exercising, their heart can pump more blood in one beat, okay, which is possible only by cardiovascular system compliance, by the blood vessels relaxing and heart being able to pump more in one beat. Okay, so this is what will change if you would exercise. Your stroke volume increases, and for a person who has much more stroke volume, he'll be able to use go to a higher level of exercise, which can be checked by things like VO2 max, which can be checked by things like VO2 max. But there is one more thing here, one more thing which comes into play, which is called cardiovascular drift. What is this cardiovascular drift? Means there is a reduction in stroke volume also after some time. What happens when you are exercising continuously in the same intensity? Your body gets warmer, becomes warmer, okay, and your body has to cool down. You start sweating because some of the blood gets redirected to your skin, okay, to attempt to lose heat through conduction, convection, and evaporation and sweating. So less blood is returning back to the heart, and therefore next time the stroke volume get reduced, and therefore to maintain the cardiac output, your heart will try and increase the heart rate. This is the mechanism how your body tries to keep your body cool as well as exercising, perform cardiovascular drift. This is a very simple funda. Now what happens? Heart rate, exercise heart rates. What is this? Let's understand what is this. Basically, when you start exercising, there is a relationship between your oxygen uptake and your increase in heart rate. For people who are not regularly exercising, their heart rate will increase very fast. Okay, their heart rate will be like this green line. It will increase very fast, and their oxygen, without having that much amount of oxygen uptake, heart rate will increase. And people who are regularly exercising will have a slower increase in heart rate, and their oxygen demand will be much more. Okay, so this is a difference between the exercise heart rate. So if you are if you exercise, if you go on a treadmill and you see that your target heart rate is achieved only in the first stage or second stage, that means you are not exercising. Your cardiovascular compliance is not very good. It's not really good. Okay, and then there is a something called a submaximal exercise, a test. Submaximum exercise, that means somebody who is just walking, or who can just 6-minute walk, and you can see that your heart rate is very high. In this submaximal exercise, your heart rate is rushing up. So this is a very simple test which you can do to check whether your cardiovascular compliance is good or not. If it is very high, very fast, and going above 150, 160, then you should regularly get you should get evaluated, and you should do regular exercise. Okay, let's understand a few more concepts here. Very important concept about distribution of cardiac output. We have talked about increase in cardiac output, which is happening during exercise, but at rest also we've seen the cardiac output is around 5 liters. Where does this blood go? Okay, this is a very clear picture where around 20% goes to the muscle, 4% goes to your heart, and the other organs, 22% goes to the kidney in normal circumstances, 27% to the liver. Okay, now what happens when you exercise? When you exercise, the picture changes. When you exercise very rigorously, 80%, 84% goes to your exercising muscle. And now this is during exercise. Okay, during strenuous endurance exercise, the highest level where you are peak at 180, 190, and that time also you can see still 1000 ml, that means 1 liter, 4% of your blood still goes to your heart, the same amount of blood which is at rest. So your body does not compromise the blood supply to your heart. Okay, but other components, other kidney, liver, they are compromised. So this is why there is a limit to daily exercise. You cannot do strenuous exercise for very long time, or else your kidney, liver will have much more load of muscle injuries and metabolic waste products later on, because during exercise they are not getting enough blood. Okay, So they will have all the activities will become anaerobic there. Okay, so that is one case. Now this is what relationship between the cardiac output and maximal oxygen uptake in trained and untrained individuals. We already have seen that people who are untrained will have much more oxygen uptake, and they will have much more cardiac output, and who are sedentary will have very low oxygen uptake and very less cardiac output, so the exercise capacity will be also low. Then let's now come to the actual topic. Why would exercise cause heart attack? Now, once we understood all the basic physiology here, now let's add disease into it. Because obviously, normal person doesn't have a heart attack. Somebody who has a problem and does not get diagnosed will have a heart attack. So there are many reasons. We can just label the most common things here. So coronary artery disease, meaning there will be hardening and plaques and blockages in your heart. And during exercise, when you increase the blood pressure so much, cardiovascular demand so much, the plaque can rupture, and this can lead to acute coronary syndrome, heart attack. Physical exertion, which means when you are exercising continuously without rest, can also lead to a lot of metabolic waste products and stress on your heart, and can lead to angina and chest pain. Even if you have some significant blockages in your heart or brain, you can have dizziness or TIAs or strokes like that. High blood pressure and arrhythmia. Arrhythmias is a very big reason which can lead to problems, cardiac arrests. In general, we have seen that generally regular exercise, regular physical activities benefit will be much more than the risks to your heart lung. But in if your case you have any symptoms during exercise, you should definitely talk to your doctor. If you have arrhythmias or sudden chest pain or any kind of issues, you should talk to your doctor. The risk of heart problems due to physical activity, it depends upon how much active you are regularly, how much athletic you are, and someone who is not fit is at a much higher risk of heart attack if he starts exercising vigorously. Somebody who just goes out and plays cricket once in a blue moon is having a bigger risk of heart attack than somebody who is going out at a gym or whatever, dance or something like that regularly. And young people can have risks if they have some additional issues like congenital heart problems, hypertrophic cardiomyopathy, congenital heart defects, myocarditis, these kind of a thing. Myocarditis would be secondary to some infection, viral infection, autoimmune disease, autoimmune infection, something like that. So that is one big reason why young people can have heart attack. That's why post-COVID people are getting heart attack, because they had myocarditis, arthritis, and much more inflammatory disease which accumulated during that COVID time. And if you are middle age or older, then heart attacks are very, very important in your case. So if you have heart problems or any chronic disease for that matter, diabetes, high blood pressure, which basically increase the risk of heart attack, and you should then slowly start your physical activity and talk to your doctor how much according to your doctor, because you might not know how much blockages are there, how much your heart is functioning. So you should get checked. Okay? And what are the risk factors? If you don't know nothing, if you don't know anything about it, then cholesterol, diabetes, high blood pressure, smoking, high cholesterol, diet which is very high in saturated fats or maybe just fats, obesity, and family history. These are the risk factors of people who might have heart attack, heart disease because of exercise. And what needs to do, what you can do, if you have a family history, then get yourself checked. If you have underlying heart condition, then talk to your doctor that what exercise you can do. Everybody, including somebody who has heart attack, heart failure, congenital heart defects, all of them should exercise. Okay, but their level of exercise will be different, their type of exercise will be different, their acceptance, their compliance will be different, and they have to exercise under the guidance of their doctor. Nobody in the world is supposed to not exercise. Even if you are bedridden, you can still move some of your muscles, right? Age is also not really the number. So at any age you can exercise, the level will be different, and you need to talk to your doctor for that. Obviously, if you are smoking, you have to stop smoking. This is a big risk factor which hardens your arteries, and therefore when the blood pressure increases, there will be cracks, and there will be deposits of cholesterol plaques. Even if your cholesterol levels are very low and there is a crack in your artery, your body doesn't have any other way of making sure that the blood vessel doesn't break away. It will deposit the cholesterol and have that calcium deposits, even if your calcium is low, even if your cholesterol level is very low. That's why if you would see many patients, they where many cases they have heart attack with normal cholesterol levels, because heart attack is multifactorial. Okay, smoking is a very big risk, high blood pressure is a big risk, so check your blood pressure regularly. And if you have seen that you have a high blood pressure, check it every day, and after rest check it multiple times on both hands, and talk to your doctor, and reduce your bad LDL cholesterol levels, and try to increase your HDL levels. Diabetes, if you have, again you have a risk. Try to correct your diet, increase your muscle mass, and take your medicines and check for your sugar levels. Fasting sugar levels much more important than post meal. HbA1c needs to be checked. Obesity is very very bad. It puts a lot of strain on your heart, on your organs. Visceral or fat is not good. It increases the risk of atherosclerosis and various metabolic syndromes. So what can you do? How can you prevent a heart attack during exercise? सबसे important, most important is gradual progression. Start slow and gradually increase the exercise intensity and duration. Slow. Start slow, be consistent, be frequent about your workouts, and make sure to listen to your body. Know your limits. Okay? Make sure that you do warm up and cool downs. Always warm up before exercising, warm up your muscles, warm up your cardiovascular system. Similarly, cool down. Don't just switch from one workout to going into the traveling part or whatever it is. Okay, know your limits. Okay, don't overexert yourself. Slow. Pushing hard beyond your fitness level can strain your heart and can be bad. Okay, don't do that. Stay hydrated. This is one more big reason which increases the stress. Dehydration during exercise. If you are not properly hydrated throughout the day, then you would have dehydration during exercise, and that will increase the stress on your body. That will increase the blood pressure to a very high level. Obviously, you have to adapt a healthy lifestyle, healthy weight. You have to maintain that. Everybody needs to do that. Everybody needs regular exercise, at least 150 minutes of moderate intensity exercise per week. That is recommended to everybody. And you have to know the signs of heart attack or heart problems. Chest pain, chest discomfort anywhere from neck to epigastrium, or even in the back. If you have that, get your ECG done. You can do your, if you have shortness of breath, nausea, lightheadedness, pain in your arm, jaw, back, get yourself checked. Stop exercising right there and then. Even if you are not having any symptom here, maybe you are having problems in your elbow, even if you are having pain in your knee, you should not exercise with the pain. Okay, you should not exercise with the pain. Wherever there is a pain, your body is telling something is getting damaged. Get it evaluated, talk to your doctor, and change the, maybe you are exercising incorrectly, maybe your form is incorrect, so you have to check that. Regular health checkups are important. Get your checkups done and find a good doctor. For heart, we have various tests which you can do. We have ECG, we have TMT, echocardiogram, we have angiograms which you can do, CT coronary angiogram, CT calcium scorings are there. Now, basic tests are ECG, echo, and TMT. Echocardiography, which we can see your heart's valves and functioning, size, shape, congenital problems. This is a must if you have any symptom. ECG and echo. TMT can be done if your basic tests are normal and your troponin levels, heart markers, cardiac markers are normal. Blood tests can be done to check your risk factors, your sugar levels, lipid profiles, iron levels, hemoglobin, etc., etc., etc. And cardiac MRI and can be done if there is a need to in depth see the structure of your heart. Some kind of structural problems are there, some myocardial bridging is there, or any kind of clots are seen inside the heart chambers. Stress thallium can be done to see during exercise which part of your heart is getting less blood supply. to see whether your stunts or your previous, if you, especially if you're already had a cardiac angioplasty or bypass surgery, then before doing any workouts you should take a stress thallium test or at least a treadmill test to check if your body, your heart is fit to go under stress, your heart can take it. Holter can be done if you feel that your rhythm problems are there. Then Holter is a 24 to 72 or maybe 1 week long Holter is also there, which can be done to check if there is any rhythm problems in your heart. So this is all which you can do to prevent heart attacks and understand that it's actually in your own hand to listen to your body. And please make sure to spread this knowledge if you have learned something from this video today. Thank you so much. This is Dr. Paramjeet.
Thank you so much for your wonderful presentation. I'm sure it was very helpful for our doctors. We do have some questions coming in from our doctors.